Good afternoon. I am Reverend Dr. Malcolm T. Bird, President and CEO of Forum Philly. On behalf of Tandem Health, in collaboration with the U.S. Department of Health and Human Services and multiple healthcare systems serving Southeastern Pennsylvania, we are appreciative of your attendance this afternoon. I welcome you to the Back to Basics Health and Wellness series. Initially, please know that this series continues to address significant and life-altering health conditions that affect a large segment of people and require medical attention, skilled therapeutic interventions, and comprehensive care benefited by good communications and follow-through by healthcare practitioners, clinicians, patients, caregivers, and even leaders like you and I. We are excited that today's session's experts will address the mental wellness and behavioral health resources and support necessary for health equity. Secondly, this series brings together clinicians and healthcare leaders committed to respectful conversation and helpful partnerships with leaders such as you and I, serving in the faith and civic sectors of this region toward improving the health equity and well-being of all whom we serve. For further elaboration of this shared commitment, join me in welcoming Dr. Daron Snyder, Vice President for Clinical Strategies of Tandem Health, to offer greetings and briefly share with us why this conversation is so important. Afterwards, he will present our U.S. HHS Region 3 Acting Director and Back to Basics partner for greetings and brief remarks. Dr. Snyder?
Well, good afternoon. Thank you, Dr. Bird. On behalf of Tandem Health, I too would like to welcome you to the Back to Basics campaign. And we'd like to thank you, Dr. Bird, for your leadership in catalyzing this event into being and for being such a longtime champion of health equity here in the Philadelphia region. Tandem Health recognizes the role of community partnerships as being so necessary and vital in order to solve and ameliorate some of the many vexing health challenges that we face. Today's topic is behavioral health. The impact of COVID on behavioral health issues in this country has been profound. The rates of anxiety, depression, substance use disorder, PTSD, and other serious mental health disorders have skyrocketed over the last few years. At the same time, access to behavioral health providers has become increasingly complex to navigate. We recognize that patients with undiagnosed or diagnosed but poorly controlled behavioral health issues are much less likely to get cancer screening and are similarly also more likely to have uncontrolled medical problems that increase their likelihood of hospitalizations and poor outcomes. Many of these challenges unfortunately disproportionately affect patients of color and other minority populations. We recognize that it will take all of us to align our resources, our priorities, and our energies if we intend to make a material difference in the lives of our community members. Tandem is committed to that cause. So with that, I'd like to kickstart our session today and turn it over to Dr. Melissa Hurd. But first, I'd like to introduce her. Ms. Hurd is the Acting Regional Director and Executive Officer of the HHS Region 3. She joined the Office of Intergovernmental and External Affairs in November 2014. In her current role, she works on a range of programmatic matters, often of a sensitive nature, with special emphasis on program policy analysis and coordination of cross-cutting issues. Melissa serves as the liaison between the Office of Intergovernmental and External Affairs and the HHS operating divisions in Region 3. She served in the Bush, Obama, Trump, and now Biden administration as a career federal worker. Prior to joining the Office of the Regional Director, Melissa worked for 10 years as member of the Regional External Affairs team for CMS. In that role on the CMS-3a team, Ms. Hurd served as the state lead for Virginia and the District of Columbia, where she handled issues relating to Medicare and beneficiaries in those two areas. Prior to joining CMS, Ms. Hurd served as a diversity account manager for the American Red Cross. Penn Jersey region, where she coordinated blood donations for use in transfusion therapy for children with sickle cell disease. Melissa holds a BA degree in psychology from Smith College in Northampton, Massachusetts. And it is a pleasure for me to welcome Ms. Hurd. Good afternoon.
Good afternoon, and thank you so much, Dr. Schneider. I really appreciate your introduction. So let me say welcome to Minority Health Month. And this is a pleasure to be with you today. On behalf of Health and Human Services Secretary Javier Becerra, I want to thank you for having me here today. It's an honor to be a part of this important event. I also want to thank Forum Philly and Tandine for having me here today. Your leadership in equipping communities to respond to critical public health issues, such as creating bridges to affordable, quality health care, maternal health, and mental health, is so vital to our genuine partnership to advance shared priorities. As Dr. Schneider mentioned, I am Melissa Hurd, and I'm the acting regional director for the Office of Intergovernmental and External Affairs at HHS. So I know you're thinking, what does that mean? It means that our regional office is the front door to HHS in this area and can answer questions, provide information, and assist with resources for the work you are doing. On a day-to-day basis, my team is engaged in meaningful dialogue with governors, mayors, tribal leaders, and partners just like you about HHS policies, programs, and regulations to ensure Health and Human Services policy, programs, and regulations are informed by your experiences. And at the center of all this work is health equity. Early on, President Biden directed all of us to center health equity in everything we do and has empowered his administration to take on the fight. As you know, it's been a long 25 months, and to date, COVID-19 has claimed the lives of nearly 1 million Americans. Many of those Americans look like me, look like us, and come from communities like ours. The pandemic has brought into focus social and racial injustice to the forefront of public health, disparities in health outcomes that you all have been fighting against for decades. At the center is the recognition that achieving health equity is hyper-local work, most successful when done in partnership and collaboration with you. And you will see more actions in that regard in the months to come. It's in our vaccine policies intended to bring vaccines to people along with our focused messaging. It's in our drug overdose prevention strategy that attempts to right historical wrongs when the faces of those with substance use disorder were Black and brown. This administration has done a lot, but there is still more work to do. And today is just another beginning. Following President Biden's State of the Union address a couple of months ago, Health and Human Services Secretary Javier Becerra kicked off the national tour to strengthen mental health in an effort to hear directly from Americans across the country about the behavioral health challenges they're facing and engage with local elected officials and leaders to strengthen the mental health and crisis care system in our communities. As President Biden launches a whole of government strategy to transform mental health services for all Americans, Secretary Becerra is leading HHS to address the mental health challenges that have been exacerbated by the COVID-19 pandemic, including substance use, youth mental health, and suicide. He's building on work that agencies across the department have been doing. Secretary Becerra and HHS leaders will hit the road in a concerted effort over the next several months to deliver on the Biden-Harris administration priorities to take on these challenges. Let me give you some data. The Centers for Disease Control and Prevention, CDC, their National Center for Health Statistics indicate that there was an estimated 100,000 drug overdose in the United States during the 12-month period ending in April 2021. That's an increase of 28.5% from the 78,000 deaths during the same period the year before. And even before COVID-19 pandemic, mental health challenges were common, with 1 in 5 adults experiencing a mental health illness in any given year. Mental health challenges were the leading cause of disability and poor life outcomes in young people, with up to 1 in 5 children ages 3 to 17 in the United States having a mental, emotional, developmental, or behavioral disorder. From 2009 to 2019, the share of high school students who reported persistent feelings of sadness or hopelessness increased by 40% to more than 1 in 3 adults and students, We also know that racism and violence targeting Asian Americans have skyrocketed to an alarming level since the beginning of the COVID-19 pandemic, taking a toll on both the physical and mental health of this population and garnering widespread national media attention. But let's see what we're doing about it. Thanks to the President, the Secretary, and the resources provided to us by the American Rescue Plan, we have made the largest aggregate amount investment, $3 billion in ARP, American Rescue Plan funding for our mental health and substance use block grant programs. But that's not all. Hundreds of billions of dollars in ARP funds have been allocated to the following: community-based violence prevention and family violence prevention programs, mobile crisis intervention services, mental health and substance use prevention, intervention, treatment, and recovery services, expansion of certified community behavioral health clinics, behavioral health care for children and young adults, and of course, the easy to remember 988 suicide and crisis line that will be launched this July. Through these awards, the Biden-Harris administration is making a bold investment to expand access to crisis for everyone. Our goal is to move from shame to compassion, to meet people where they are, to have available the resources they need to move to recovery and well-being. And now it is my pleasure to introduce the moderator for our panel of experts in this area. John F. White Jr. has dedicated his life to serving the city of Philadelphia. He began his career as a community organizer at the Philadelphia Urban League more than 25 years ago. Mr. White served as a member of the Pennsylvania State House of Representatives for the 200th District in Philadelphia in 1976. During his 5-year term, he sponsored several key pieces of legislation tackling a range of public policy concerns, including juvenile justice, prison reform, social welfare, and energy issues. His leadership led to the appointments to the Mass Transit and Democratic Policy Committees. He was also elected chairman of the Philadelphia delegation to the Pennsylvania House. Mr. White returned to Philadelphia's political arena in 1981 when he was elected as a member of the city council. During his 6 years as a city councilman, he served as chairman of council's Health and Human Services Committee, where he upgraded the city's Department of Human Services, increased foster care placements, and established a comprehensive emergency utility fund to assist Philadelphians, with heating costs. Finally, Mr. White completed a 4-year term as the executive director of the Philadelphia Housing Authority, which prior to his arrival was described by housing experts as being one of the most troubled housing authorities in the country. However, with 2,000 employees, including its own academy-trained police force, serving over 43,000 residents with the annual budget of about $115 million, the Philadelphia Housing Authority ranks as the 4th largest city in the Commonwealth by its size alone. Under his leadership, Mr. White guided PHA, the Philadelphia Housing Authority, from the darkness of patronage and waste to a model that has been hailed as one of the nation's best. As president and CEO of the consortium, a community mental health and mental retardation center in West Philadelphia, he continues this outstanding commitment by advocating for the health and well-being of the consumers in the West Philadelphia community. Mr. White attended Westchester University and the John F. Kennedy School of Government for Senior Executives. Please join me in welcoming John White as the moderator for this panel. Mr. White.
Mr. White, you are on mute.
Okay, I was thanking Ms. Hurd for her introduction and for her work, her leadership here in the region. On behalf of the Biden-Harris administration, Reverend Byrd, Dr. Byrd, we want to thank you for arranging this forum and giving us an opportunity to give some firsthand views and perspectives on where we are today with respect to our behavioral health and SUD, substance abuse disorder needs. I think it would be helpful if we could get very brief introductions on the part of the 3 panelists so that we have some context for the work, the conversations that are going to be taking place. I've known Jerry Walker, seems like forever, from her days before coming to the good administration, working with my dad, when he was assistant managing director. I found her to be one of the consummate professionals in local government and beyond. So, Jerry, if you would just give us a brief introduction of yourself, followed by Ms. Coley, then followed by Dr. Brown. We'd appreciate it.
Okay. You've heard that I did work for city government. I was city rep and commerce director under Mayor Good, had my own company, but right now I'm the president and CEO of the Behavioral Wellness Center at Girard, formerly known as North Philadelphia Health Systems. We have approximately 272 beds. 65 of them are acute psych. The rest are drug and alcohol rehab and a 700-member methadone clinic. I'm really pleased to be here this afternoon and to hear from some folks that I don't know, and hopefully we'll get a chance to know better.
Thank you. Ms. Coley.
Good afternoon, everyone. My name is Ann Colley, and I am currently, can you hear me?
I'm having difficulty hearing.
Can you hear me now?
Mm-hmm.
Okay, so I'll speak up so that there's probably a fan in the background that's stunting, but I currently am a business owner of a group practice in the Jenkintown area, right outside of Chestnut Hill, where we provide individual, family, and couple counseling to individuals. I started this practice in 2012, and it has grown to currently employ 7 therapists along with other staff. And our focus is really on Black and Brown people in giving them access to persons who look like them, because oftentimes, and they are looking for individuals who look like them that can relate. And so I started this practice with that in mind. Prior to that, I was an associate pastor at Enon Tabernacle Baptist Church for 6 years, where I focused on pastoral care and outreach. And then after that, I got my license as a marriage and family therapist. I worked as a clinician inside the public school system as a mobile therapist, as well as in their wraparound program, working with inner city children, mostly on the west side of Philadelphia. During my time there, I had the opportunity to also I was the co-founder with the founder of Black Men Heal, which is a nonprofit organization that looks to advocate for Black therapy for Black men. I also sit on several boards who focus on Black people as far as mental health. I sit on the GPHA board, and I used to be on the board member of, like I said, the Black Men Heal. And so I'm delighted to be here to talk about what my perspective is and what I've seen over these 20 years that I've been doing therapy in the city of Philadelphia. Thank you so much.
Thank you. Dr. Brown?
Thank you all for having me. My name is Funke Afolabi Brown. I am, can you hear me okay?
Yes, ma'am.
Okay. I am a pediatric pulmonologist and a sleep medicine physician. I'm also the founder of a company called Restful Sleep MD, where I help busy professionals and their children prioritize sleep, mainly because I'm seeing the impact of sleep deprivation on overall health and wellness. And I've just really been on the mission over the last couple of years to empower people with the knowledge of how sleep impacts their mental and physical health and their overall well-being, because I see it as, it's a critical pillar of health, but it's often neglected and put on the back burner. But it turns out that it plays a huge role in our ability to heal, both physically and mentally. And I'm glad and delighted to be here.
Thank you very much. Let's get right into our conversation. Prior to COVID, the people that we serve in behavioral health are already disproportionately represented across just about every health morbidity that we're aware of. Mental health and substance abuse, though, were really never the focus or the primary focus of some of those efforts. Then COVID came along, and that no doubt exasperated so many of the problems that we were facing even prior to that. So what's that mean now? What are we seeing? And more importantly, what does the future hold? What are the issues and the concerns that we're going to have to be addressing as a result of the leftovers from COVID, which is going to be with us probably forever? But the behavioral health aspect, how it impacts on our children, our families, are important. Ms. Walker, I'd be interested in hearing from you, our audience would be, what are you seeing in this environment, in the services that you're providing, both on the mental health side, but of course, along with the substance abuse situations that you're addressing as well?
Well, what we're seeing, clearly we're seeing a lot of trauma. We're also seeing a lot of folks who are suffering from physical abuse because of depression, because of isolation, a lot of alienation. There seems to be a lot of domestic abuse and just out and out fights. People are feeling vulnerable, and other people are feeling like they don't have any way to regulate themselves. We all know that just the isolation for folks who are not mentally ill or suffering from substance use disorder, depression has skyrocketed, not only for young people, but for people of all ages. And another side effect, but a very important one, is we've seen a lot of our female clients who have suffered rape. And with all of those things on top of the initial diagnosis, it becomes a lot more complex. Because of COVID, we really did have to stop our family counseling and the sessions that we had that were really supportive for our clients and for our patients. We're just getting back into that possibility of starting up that process. The fact that we could not bring in the other kinds of supports that normally would occur, just the AA meetings, the other kinds of group meetings, folks who come from outside who offer the support that normally would be there. So not only for our patients, but for our staff, the whole idea of COVID has become a stumbling block to moving forward. Everyone seems to be kind of in a wait and see situation. The whole idea of safety, so that physical abuse that our patients have been suffering has spilled over into our residential. So we've had to do a lot just in terms of looking at how do we keep our staff safe in addition to our patients and our residents. Yeah, there's a lot more, but
A lot going on. And Reverend Coley, in your practice, you're dealing with a particular aspect of our community. Would you talk a little bit about what you're seeing with amongst your families, amongst your the men that you're serving?
So first, let me say that prior to COVID, I would not have advocated for online therapy. I've always done therapy inside of an office, and I thought that that was the best way to provide the services. However, you adapt, and we had to adapt in order to reach our constituents. And I will tell you that it has been a lifesaver, and it has worked, and it has extended the outreach to people who may not have been able to get to my office. And so we've been able to reach people as far as all over the city of Philadelphia, but Delaware, New Jersey, and even New York. And so I am delighted that this platform has kept us in touch when we were isolated. But the biggest thing that I'm seeing in my practice are three things. One, there's definitely an uptick in the anxiety level of students. I'm getting a lot, and I do mean a lot, of calls from counselors in schools that are looking for therapists to work with children in the schools that are around me, Cheltenham, Abington, so on and so forth. So this pandemic has impacted everyone, but particularly our children, because as we understand, during this time period of elementary and middle school, their brains are growing. This is a time where they should be social, and they were ripped away from this opportunity for 2 years and isolated in home. Sometimes in homes where they had to be at home by themselves because the parents had to work. And so anxiety is at an all-time high, not only anxiety, but sadness and depression. And so we're seeing a lot of that, and we're addressing that. But let me be clear, because I think that I'm not a person or a therapist that I think that we should pathologize. And we don't have enough time to get into the whole DSM-5 and the pathology of diagnosis and how it does not serve Black and brown people well. And that is a Eurocentric concept and framework that really oppresses us. So let me say this, my framework is a framework of trauma. And if we begin with the fact that we have been traumatized. So prior to even the pandemic, Black and brown people lived in a country that traumatizes us at any given point because of where we sit, where our social location is for class, gender, and race. And after the pandemic, because of where we were prior to the pandemic, that just shot our trauma 200%. And so now we're isolated. We're not getting the care that we were supposed to get. we're being not given the types of help that we should have gotten. And then on top of what Ms. Walker has stated, people who were using schools and their jobs as a getaway from the environments in which they live no longer could do that. And so there's this increase in domestic violence. There's an increase in children who were living in poverty and not having access to meals, the love and care that sometimes they only receive at school. And so it is not that they are depressed. These are simply symptoms of the traumatic experiences that we have had to experience just being Black and brown people, but conflicted, or I'm sorry, not conflicted, but exacerbated by the pandemic. And so as we're doing our work, I think it's very important that we understand, and it has been my experience that not even therapists, a lot of them understand what trauma does. It changes the framework of our brain cells. It changes, we're not supposed to have cortisol that is constantly released. And so this is what happens when you are frightened, when you are in a space where you are constantly having to look over your shoulder and be worried. And this is where our children are. And now they've gone back into the school system. I'm a diversity, equity, and inclusion cultural humility consultant, and I consult with organizations, particularly educational organizations and mental health organizations, around how to provide trauma and cultural competent therapy. And one of the things that I'm seeing in the public school systems now is that there is a lot of violence that is happening, and it is not being reported. Not only the violence, but the children's attention spans, because again, for 2 years, they've been pretty much able to do what they wanted to do.
Yeah.
And without very little. So I'm going to stop there because I could talk about this for days and hours, but trauma, anxiety, and the symptoms are anxiety, depression, sadness, and violence, as Ms. Walker stated.
Let me push on that for just a moment.
Sure.
Telehealth or teletherapy, trauma. On a Tuesday, we were not allowed to do telehealth. It's a public agency. All of our services had to be face-to-face. On Wednesday, all of the practices, all of the skills that had been developed through that face-to-face engagement went out the window. And overnight, without any additional training, without any additional references, we're now on the phone trying to engage people who are experiencing the very trauma that we're trying to address, especially amongst the substance abuse community. That human interaction, that group therapy, that face-to-face interaction was a means of support and a means of assistance and help. It helped to give people ideas on how to deal with their ongoing struggles. All that goes out the window. What are the lasting effects of that? Anyone? What do you think will be the lasting result of that?
So if I may say, I'm in a little different position than maybe Ms. Walker or other organizations, in that, one, I'm a private organization. So private organizations are able to do things a little bit differently than those in the community behavioral health. So I do not do phone therapy. I do video therapy. So I was seeing my clients. We were still, even though we weren't in the same room, we were still seeing each other. And I will say this, that the board that I sit on, which is the GPHA, Greater Philadelphia Health Action, what we have seen is that there has been greater, the percentages of people who are actually coming to therapy has grown 100%.
Whoa,
because
stop
now
right
they
there.
don't.
Stop right there. Stop right there. That's not everybody's experience.
I understand, but let me finish. So GPHA, which provides behavioral health and is one of the largest organizations in Philadelphia to provide behavioral health, saw an uptick in patients coming to their therapy, even over the phone, even on video. So clients were engaging more because they didn't have to give transportation. They didn't have to find someone to watch their children. And so we've seen an increase. Now, for some, you are correct. There is going to be, because they lost that. But I am saying that we can't just focus that there is a negative, that there was also a positive, that more of us have been engaging in mental health than I am seeing historically over the 20 years that I've done therapy.
Can I speak to that? And I think because I come from a different perspective and we are Medicaid based, we need to look at the difference in the demographics of the folks who are engaging. And I think that you're absolutely right, just in terms of, because I have friends who have used video and engaging in therapy for mental health. When it comes to our clients who are suffering from substance use disorder, the whole idea of the video counseling, it works for some, but most it does not work effectively for. And for counselors, they're not only doing individual counseling, they're doing group counseling. So it's difficult to engage a group when you're talking about Zoom. And one of the things that we've said very clearly, because we've brought all of our counselors back on campus now, that especially in our residential areas, they are high touch environments. Each of those people needs to see somebody, touch somebody, hear somebody to stay at the level of support and for them to actually start to withdraw and get to a point where they feel that they can operate on their own. So as excited as we were about telehealth and as excited as we were about people being home and having their own kinds of schedules, we just saw it fall off. And even and the other part is that a lot of our clients are transient. So having a phone one day, not having a phone another day, being able to get to a computer one day, being able to get to one another day. So I think you're right. I think in certain instances, it works very well. For our clientele, it has not been so successful. And I've been telling my staff that we've really got to think outside of the box.
Yes.
Like how are we gonna make this work?
And Jerry, we're also talking to staff who are traumatized themselves.
Yes, yes.
Who are experiencing, whether we want to admit it or not, they are experiencing the same type of aftershocks as the people that they are serving. So the resources now that we may have been providing to support staff have to be increased tenfold in order to support those individuals and to encourage them to seek assistance.
Yeah.
The other point, though, what I found interesting was the comments that have been made about children and families, again, in the public sector. With such a great need, why are there open slots for family-based services for children? Why is there a waiting list? There's a serious disconnect here. We're talking about the effects of trauma on our families and our children. There are evidence-based practices that are in work here in the city of Philadelphia in particular that have open slots because the system is not responding to those who are saying, I need this help. So where does advocacy come in? Where does advocacy come in? Anyone? Okay, that was my politician coming out. I'm sorry.
When you say open slots, what do you mean?
We have vacancies. We have slots that are available to provide that support and treatment to those children and families, but they're not coming. We're not getting the referrals, generally speaking, from the county or from the city. So you're sitting there knowing that there is a need, but you don't have the ability to actually reach them and be effective in what you're doing because they're sitting on a waiting list. One of the things that those—
So you're saying there's available slots,
yes,
but they're on a waiting list.
There are available slots in family-based services, in functional family therapy, Two, evidence-based practices, internationally recognized, and you have vacant slots with kids and families in need of those services. So that's all a part of it, right? And when we're talking about staff who are impacted and traumatized by the same events, the kind of support that our staffs need are different. I don't know whether Dawn Curry can hear me or not, but Dawn heads up a piece at the consortium where it's like an open forum for staff to come in and to talk about, the things that they're feeling and to get support from one another. And even at that, it's almost like pulling teeth to get people to participate, either one-on-one and in a group. So we've got these needs, and we're in a place where we can provide some of the help, but at the same time, the system is not responding. You know this. In Philadelphia, we are one of the most well-served cities in this country. There are more community type and community-based services available in Philadelphia than the vast majority of our major cities, not being utilized. Not because people aren't interested, but because the system is not a welcoming system that opens up a valve that allows the folks like a Jerry Walker, like GPHA, though that's on the FQAC side, to really put all of those skills to work for those who are most needy. So this is what happens now. COVID has become a convenience. It's a convenient excuse for why people don't do what they do. Well, that will never work. There are going to be after effects. There are going to be aftershocks as we continue to go through it because it won't end. Are we equipped to respond to that? I don't think so. Maybe some others might have a different view. But are we equipped for what comes next, Dr. Brown?
Well, from my perspective, what I see, what my experience and my practice has seen, of course, like others have said, has been an uptick in the number of children or parents that are bringing their children in with sleep issues. And so sometimes some of that trauma that they may be experiencing and the anxiety may just manifest as no sleep, or needing a parent to be present for them to sleep well. And so, there are not too many people that do what I do, which is, focusing really on children's sleep and also, on women as well. So I definitely see the interrelation. And sometimes when they're referred to me, it may be from a mental health provider who has seen that there's that relationship between sleep and depression, anxiety, bipolar, ADHD, all that stuff. But it's something that I see, and I'm really starting to appreciate that there is a very important piece, and that is that we all just kind of work together, and we work collaboratively. Because no matter how much I try to fix their sleep with strategies, if the underlying issue is still there, if the feeling of vulnerability and fear and the constant exposure to trauma is not being addressed, then, I'm really just putting a Band-Aid on things.
Exactly. Where does faith fit into all of this? Where does the faith community fit in to providing that additional support and encouragement to folks who are going through these issues? It goes beyond the sermon, right, into the various ministries that are taking place in our congregations. Is there more space? Is there more room for more active faith-based organizations to participate in this?
Absolutely.
I think definitely. And the question is, what is their role and what are they ready and willing to do? In a couple of ways. Faith-based organizations are already working with a group of people.
Mm-hmm.
That can be information source and information givers. I think education is a really big part of this. When you say, are we ready for what's coming down the pike? We have to really be able to educate not only the folks that we're treating, but their families and their communities about what they're seeing and what resources are out there. What you talked about, John, is coordination. In all my years in government and in my own company, just they're as coordinated as we think we are, and as many committees as we think we have. The coordination of services and having the right people at the table to kind of talk about things in a way that makes sense from the grassroots all the way up to the top, if there is a top, just never seems to happen. On the other hand, I think the faith-based organizations have a big role in terms of what they do best. Prayer, spirituality, part of our mission statement is that we provide services in a spiritual and culturally sensitive manner. So being able to collaborate, partner with a provider, to be able to say, if you have someone who is interested in having faith as a part of their treatment, I'm available. I think that it's an area that we don't explore, and sometimes we get into the separation of church and state. But I think that even if you look at the 12 steps and a lot of other approaches, there's faith at the very foundation of it, so that someone has a center and a focus to be able to move from that. And I think that is lacking in our communities in a way that we should take a harder look at, especially going into the period that we're getting ready to go into.
Yes. Well, as a Baptist deacon, I've come to really appreciate in this space the value of spirituality and the opportunity to assist people in finding their center, regardless of their faith. I think Stevie Wonder says it's not the religion, it's the relationship. And we in the past have had ministers, including Dr. Waller, come in and to spend several sessions talking to our counselors, particularly on the substance abuse side, about the role of spirituality in treatment and in recovery. We're quickly running out of time.
Mr. White, if I may give
John,
you some,
please.
John. As clergy myself, I'd like to also offer up is that for as much as the churches are doing, I do believe that there's more that can be done. Because unfortunately, there are still pastors out here who do not believe in therapy and have spoken against it. And oftentimes I have experienced clients who have come into my office and have suffered for many, many years.
Yes.
And refused to come to therapy because of shame, of guilt, that they were not more faithful. They need to pray more. They need to read their scriptures more, and that God would deliver them. And so one of the things that I have been doing is advocating within the religious community, particularly in the African American community, to educate clergy that going to therapy is not antithetical to being a, quote, good Christian. As a matter of fact, I know that there is biblical mandate as well as scriptural references that I have provided and shown where God is actually calling and telling us to seek wise counsel. And sometimes that wise counsel is in the person of someone such as myself, who also, one, knows the Bible, but is also trained in therapy. And so one of the things we do in my practice is that I have several people who are trained on the psychological side, but we also are trained to provide the spirituality side. So we can do both and not either or, because I think that to be whole, and especially if we're talking to the Christian community, the Bible tells us that we are to renew our minds. We are to love God with our mind, heart, and soul. And sometimes our mind is out of whack, and we need a safe space because of the trauma that we have encountered to be able to go to someone. So I have relationships with several pastors around the city who, when they know that they call it, that's not my lane, so people will come to them. And if they're not able to help that parishioner after 4 or 5 sessions, they will refer them to me. And so, because they know 2 things. One, they are not going to get in an environment where their spirituality is either ignored or it is pathologized, and they're going to get the psychological side of that. So there is more that the religious community can do, because it takes all of us, as Ms. Walker said, there's a collaborative part that we all must do our part. And we cannot separate it because we're mind, body, and spirit.
Yes, indeed. Well, I guess we've just got a couple of minutes left. I don't know if how you want to proceed from this point on, Dr. Bird, but if there are any closing comments anyone would like to make at this point, please feel free to do so. We've got a couple of minutes left.
I'd like to say something that you touched on, John, and that I think is really important as it relates to the staff that are working with folks, the need to support them, to educate them about self-care, taking care of themselves. Dr. Brown has talked about sleep. We've put together a wellness program, and it's interesting, is a full plethora of things, and getting people to take advantage of them is really, really difficult. I'm at the place now where we're going to be scheduling them to go.
Oh,
because we did that with one group, and they were like, oh my God, this is the best thing since sliced bread. But you can't expect people to do things they haven't done unless they're actually pushed into it. So I think it's really important for us to take care of our staff, because they can't give what they don't have.
can I copy that with respect to scheduling people to come?
Mhm.
I'd like that. I'd like that. I'm sorry, I was interrupting someone who was getting ready to speak. Dr. Brown?
Yeah, so just to follow up on that, Ms. Walker, I think, prioritizing ourselves in terms of our own health in order to show up the best way we can is really important as well. And sleep is actually very critical to that mission. Most of the time, we own sleep deprivation as a badge of honor. And so really changing that narrative as leaders, helping people see that when you sleep better, first, you're in a better space to think and make critical decisions. And some of the decisions that we make are life altering. And so really understanding how important that is and taking action to make sure that we do take care of ourselves, have time to rest, recover, so that we can then be blessings to those around us is important. And also just, like Ms. Khalid mentioned, just really being vulnerable enough to say, I need help, and reaching out so that we take down that stigma of, mental health and being seen as weak when you're having to cope with so many things that you were not necessarily designed to handle on your own. And so encouraging people to do that.
Thank you. Well, thank all of you for your participation this afternoon. I'm going to hand this back over to Dr. Bird or to Jermaine for any closing comments that they would like to make.
Good afternoon, and thank you, Mr. White. We so appreciate you and the panelists and the expertise that you brought to our discussion today. My name is Jermaine Bromell, and I am from Tandem Health. And again, we thank Mr. White, we thank Ms. Walker, we thank Ms. Coley, as well as Dr. Brown for their contribution to our program today around mental wellness and behavioral health. And we recognize the importance of them helping to keep the conversation going around how we can best engage our faith and civic leaders around helping to improve outcomes and getting back to the basics and addressing some of the challenges that COVID has created. So I would like to thank my company Tandem, as well as Forum Philly, again, for their role in helping to bring this program to us In addition to them, thank the other collaborative partners and health systems that have helped make this event possible, and the many key people who've been part of the steering committee that have helped us to develop this program and this focus around how we help to address gaps and bring these resources and services to faith and civic leaders. Certainly, we want to thank the Office of the Regional Director for the U.S. Department of Health and Human Services and the Acting Director, Melissa Hurd, for her role in not only serving as a speaker today, but really being a part of where we are going to go from here. So I'll ask her to jump back in and talk to us a little bit more about what is to come.
Great. Good afternoon again, everyone. And thank you so much, Jermaine. As Jermaine mentioned, I just want to echo his comments briefly by saying thank you to all of our collaborative partners. This discussion has been lively, it has been robust, it has been very engaging when we talk about mental health, and definitely when John introduced the topic about spirituality and faith and where we go from there, and how we can, of course, integrate faith and spirituality in our seeking of counseling and services. They don't have to be separate, but they definitely, we want to make sure that we're serving the entire person. Next week, we are concluding our series for phase 1 of the things that we have missed during COVID, during Back to Basics. It will feature a lively discussion with regards to environmental and social determinants of health. I think about the recent hurricane and tornado that swept through the Northeast here. And unfortunately, the people in Bridgeport, I think it's Montgomery County, that were put out of their homes because of flooding. I think about a lot of the things where people are living in flood zones or in areas where there are a lot of environmental toxins and children being plagued by asthma. So we're going to get into that next week. Next week will be our fourth event in this series. We started a couple of weeks ago for National Minority Health Month with cancer screening. Last week, we moved into diabetes. Today was mental health and wellness. And next week, we will go into environmental and social determinants of health. That's on the 28th. If you have not done so, I would encourage you to please register for this session. As you can see, we have some great speakers and panelists, and we want to hear what they have to say and how we can assist people in our community to make sure that we're shining a light on this topic, but also working towards a solution. So thank you so much for that. And also, I just want to encourage everyone that we're moving forward with all of this information. This is just the beginning. We are also going to have a phase 2 where we're reaching out to consumers about these topics and making sure that they are engaging and having conversations with not only mental health providers, but with their primary care physicians if they have with, or if they're going to the FQHC to get their regular testing done. We want people to do something as a result. It's not just for us to talk to one another, although that's great. We want people to do something. So thank you so much, Jermaine. Thank you again to Forum Philly. Thank you to Tandem Health and all of the other collaborative partners. And I'll turn it back over to Jermaine. Thank you.
Thank you, Acting Director Hurd. Again, we appreciate your time. We thank the panelists. We recognize that this is an important first step around how we look to address the needs of our community, and really how can we help to raise awareness and mobilize faith and civic leaders to make a bigger difference among their constituents, and recognizing all the different constituencies and different religious leaders and civic leaders across this area. We want to work with you all because we recognize the interrelatedness between physical and mental and behavioral health. And we want to make sure that we have resources to help support your constituents in our broader community. So as Acting Director Hurd said, the next phase of this will include stakeholder sessions and really focused around faith and community organizations as well as consumers, as we look to see how do we refine the message, how do we bring more organizations on board to be able to go to community meetings and help highlight some of the services that are available for folks, and think about the things that have been missed during COVID, like in previous weeks, as we've talked about with diabetes, as well as with cancer screening. So we look forward to your continued involvement and engagement, and we thank you, and we will look forward to our next conversation next Thursday, the 28th at 1 p.m. with a focus on environmental and social determinants. So thank you all, and please tell a friend. We look forward to seeing you next Thursday.
Thank you all very, very much. Take care now.